Hello everyone. In today's presentation, we'll be looking at a product that has been part of Ayurveda for several centuries, and yet its mechanism of action forms the basis of the most recent developments in the anti-hyperglycemic medication, hence providing the perfect example where the age-old wisdom in form of Ayurveda and other traditional medication system forms the basis of the modern science. In this presentation, we'll be talking about pTeroSol, its traditional application, its relevance in the modern times, the clinical studies substantiating its efficacy, and how this product differentiates itself in the healthy blood sugar support category. Before I discuss the pTeroSol, I would like to give a brief introduction to Sabinsa Corporation. Sabinsa Corporation was established by Dr. Muhammad Majid in 1988 with an aim of bringing science-based natural products and extracts with the particular emphasis on achieving the highest quality through biomarker-based standardization and innovation backed by traditional knowledge and modern science. Today, Sabinsa Corporation has market reach in all the major markets across the globe. We have innovation engine fueled by over 120 scientists and PhDs, and this innovation was properly secured by acknowledging the IP in this innovation, leading to over 260 plus patents. Sabinsa is also a vertically integrated company with a farming land of over 40,000 acres and over 6,000 strong force of farmers. And we as an organization understand our social responsibilities towards the farming community who have supported us in bringing these ingredients to the table. And the Indian quinoa tree or the Pterocarpus marsupium has been a cornerstone in the Ayurvedic system in the management of diabetes. Pterocarpus is also unique in its chemical profile as it has polyphenolic rich aerial wood part which provides us another compound called pterostilbene, which is a trans-stilbenoid structure, an analog to resveratrol. In other words, pterostilbene is a close cousin of resveratrol, a compound which you may easily associate with wine or French paradox. Formerly, it was also considered as the major active of the plant, and many activities associated with Pterocarpus were actually associated with pterostilbene alone. However, a closer look by our scientists into its use in the Ayurvedic system revealed some very interesting phytochemicals, which were inherently present in the Ayurvedic preparations which have been trusted for ages. Thus, the pTeroSol was born. Pterosolve is an aqueous extract of Pterocarpus wood, which is standardized with two glycosides called Pterocarposide and Sabioside. These are the two major glycosides. However, they are not just any ordinary glycosides, but in fact, their structural characteristics make them highly potent in maintaining the healthy blood sugar levels. We'll be talking a bit more about them in the future slides. Now let's talk about the genesis of pTeroSol, or how the use of Pterocarpus became the evolution point for pTeroSol. If you look in the literature, we see that the practice which was followed for using Pterocarpus in management of diabetes was to use the wood powder or the wood shavings or the tumblers made up of Pterocarpus wood, and by soaking them in the water overnight. This water leaches out the active compounds from the wood, which are then consumed by the patients next day, and this process is repeated multiple times. Now, what is actually happening here is that the water-soluble compounds, which we will discuss later in the next slide, gets extracted in the water by soaking the wood overnight, which provides the anti-diabetic activity. So the main focus for us then turned towards understanding the anti-diabetic activity present in this water extract. On this slide, you can see the naturally occurring C-glycosides present in the Pterocarpus heartwood. Now at this point, I would like to give you a brief insight how our scientists were able to identify and isolate these C-glycosides. Now, determination of active compounds in a crude natural product is quite a challenge in itself, as you start with the crude extract and start following the activity trail across different fractions. The natural product development becomes even more challenging because of the very nature of the raw material, where the actives can have variations like seasonal, geographical, age of the plant, or even the soil characteristics. But the real and consistent value and the quality of product can only be achieved once we are able to overcome these challenges. Under the guidance of Dr. Mohammad Majid, Sabinsa pioneered the biostandardization in the natural product industry. In pTeroSol, our scientists followed the same trail, starting from the raw material and going through various extracts and their fractions and subfractions, and zeroed in into two new compounds called Pterocarposide and Sabioside. These are the polyphenolic C-glycosides. Sometimes these chemical terms seem challenging to keep a track of, but as a thumb rule, you can remember that the glycosides are the compounds where the sugar moiety is attached to another compound, which, for example, could be polyphenols. And depending on how they connect with other compounds, these glycoside bonds can be O-glycosides, N-glycoside, S-glycosides, or C-glycosides. While the O-glycosides are very common occurrence, the C-glycosides are the rare types. And in this presentation, we will concentrate on these C-glycosides. C-glycosides also attracted a lot of attention as many of them demonstrated their effectiveness as the therapeutic agent. So we may ask, what is so special about these C-glycosides? From the structural point of view, the C-glycosides are resistant to enzymatic or acidic hydrolysis. And from the functional aspect, the C-glycosides are actually considered potential candidates for the management of hyperglycemia. The reason is that the C-glycosides are very good inhibitors of glycoprocessing enzymes in the body. Now we will see how C-glycosides can actually help to manage blood sugar levels. So while the conventional blood sugar level management strategies revolve around maintaining the insulin levels, reducing the insulin resistance, inhibiting the calorie absorption, or interventions related to the changes in the lifestyle and dietary habits. In last few years, the focus has slightly shifted to the kidney and its role in glucose homeostasis. Kidney is involved in regulation of glucose via gluconeogenesis, also taking up the glucose from the circulation and also by reabsorbing the glucose from the glomerular filtrate. Each day, the kidney filters 180 liters of plasma and filters 180 grams of sugar, and almost all of it is reabsorbed by the means of a sodium glucose cotransporter called Sglt2. In people suffering from the hyperglycemia, it was found that the Sglt2 cotransporters showed higher activity, thus meaning transporting more of the glucose back into the circulation. In fact, the Sglt2 transports the glucose as an active process, which means it moves the glucose against the concentration gradient and hence utilizes energy for maintaining even this function. Now, inhibiting Sglt2 can actually help to reduce the reabsorption of sugar in the kidney. Sglt2 is also considered as a potent target for various reasons. First, reducing the reabsorption of sugar back into the bloodstream, reducing the filtered glucose load on the vascular tubular renal components from hyperglycemia-induced damage. It also helps in reducing diabetes-induced inflammation and injury. in managing blood sugar levels without creating hypoglycemic conditions and managing HbA1c. So till now we have looked at the Pterocarpus and its traditional applications, uh, presence of C-glycoside in Pterocarpus extracts which were used traditionally. We also looked at the function of C-glycosides on the SGLT2 co-transporters. So now let's look at the clinical evidence on this natural product which contains the C-glycosides, well known as SGLT2 inhibitors. ICMR, or the Indian Council of Medical Research, a part of the Research Council of Government of India, CSIR, conducted the first clinical study on Pterocarpus extract. This study was carried out with an aim to evaluate Pterocarpus used in Ayurveda for managing the diabetes and specifically looking into non-insulin dependent diabetes mellitus. Another point of investigation was to see its effect on HbA1c levels and for seeing the safety of using the Pterocarpus for a longer duration. This study was undertaken for 3 months on the newly diagnosed patients, which were first put through a dietary intervention to see if the diet therapy can resolve their hyperglycemia. After which, the selected patients with hyperglycemic conditions were started with 2 grams of dosage. After 4 weeks, if there was no improvement, the dosage was increased further to 3 grams and further increased to 4 grams if the dosage of 3 grams did not produce any health benefits. Otherwise, the lowest dosage found to be effective was continued for the rest of the treatment period. During each week, the analysis was carried out on the blood glucose levels, while the liver functions and the renal function were studied every 4 weeks, and HbA1c was studied at the beginning and at the end of the study. Now let us look at some of the results from this clinical study. In this study, 97 patients were selected to follow through the trial for the 12-week period. At the end of the trial, 69% of the patients showed control in both fasting and postprandial levels of glucose. In half of the patients, that is 49 patients out of 97, 2 gram dosages achieved the control levels, whereas 3 grams 11 patients needed, and 4 gram was administered in 7 patients. In addition to the blood sugar levels, patients who had problems of polyuria found complete relief, as well as 67 patients showed improvement in polyphagia. Patients showed no significant difference in the liver health or the lipid health, and HbA1c levels was found to be reducing or lowering in some patients, but because of this short duration of study, a longer duration with a larger patient group was recommended. It was realized that effective dosage was between 2 to 4 grams, and with a longer duration in comparison with a standard drug, we can perhaps evaluate some of the trends which we saw in the first trial. And with this aim in the mind, another trial was held by ICMR. The second trial was carried out with the gold standards of randomized double-blind trial with a flexible dosage. The study was carried out with a larger population of 365 patients with a newly diagnosed diabetes were enrolled and randomized into 2 groups. The escalation of dosage was carried out in the same pattern as the previous study. Hence, the patient who did not show improvement with 2 grams at the end of 4 weeks or 3 grams at the end of 8 weeks were upgraded to 4 grams by the end of 12th week. And this administration of supplement was carried out for 36 weeks. With the larger patient pool, the double-blind model, and the longer duration, some very interesting results came out of this study. About 86% of patients showed control in blood sugar levels in both postprandial and fasting levels, which can be compared to the 93% patient which showed control in the tolbutamide group. The dosage at which the control was achieved in the Pterocarpus group was equidistributed among all the dosages of 2 grams, 3 grams, and 4 grams. The HbA1c level also showed control in 22% patients in Pterocarpus group compared to the 29% patients in tolbutamide group. Over 90% patients showed resolution of glycosuria. There was no hypoglycemic episode observed in this study, and the safe dosage of Pterocarpus was found to be 4 grams, and the study showed sustainability in the blood sugar level management up to 72 weeks. The 2 patents mentioned on this slide were acquired by Sabinsa Group by entering into a tripartite agreement with IIM and ICMR. There are some salient features of this product which I would like to point out. First, the product differentiates itself in its mechanism of action. Second, the unique feature of this product is the presence of C-glycosides. The third is it has shown control in both fasting and postprandial blood sugar levels and also in HbA1c levels, which shows its long-term benefits. It helps in reducing the polyuria and polyphagia problems, which reduce the quality of life as the disease progresses. Now finally, it is a water-soluble extract, which means it can be added into liquid dietary supplements, something which you don't see regularly in the blood sugar support products. Now, if you recall earlier in this presentation, I mentioned that this product is a testament to our social responsibility. SAMI Labs, which has over 30 years of its existence, has also acquired knowledge on the agri practices of medicinal herbs, which also becomes an asset for the company when it needs to select the plant material for its products. Pterocarpus is one such material. Since the material used in the study is the heartwood, it means that there is a significant requirement for the sustainable practices to allow the optimum use of the raw material without creating a deficit in the available resources. And SAMI Labs took strong steps to ensure the wide-scale replantation in this area. In fact, Sabinsa Corporation received awards for industry initiative in 2018 from NutraIngredient USA and for supply chain transparency from the Nutritional Business Journal. Both awards were received by Shaheen Majid on behalf of Sabinsa Corporation. So as you see, PTeroSol has a story for itself, which brings both science, social responsibility, a forward-looking mindset, and also appreciation for the knowledge acquired for the centuries and disseminated to us. Thank you for your time.